Hi, Boris Rani here at Restore Revive 360, and today I would like to talk about elbow pain, especially if you have elbow pain on top of your arms around this area. I'm not going to get into too much into the anatomy. I would like to get into the exercises and the stretches and massages that you can do for yourself. So generally speaking, we are stronger on our flexor compartment. So like gripping the wheel of the car, holding groceries, texting, like everything we do is kind of like here. Very rarely we need to extend our wrists and our fingers and then get something stronger here. So what happens is that our flexor compartment gets tighter and stronger than the extensor compartment. So there is like this imbalance that goes around this joint. The elbow joint, we're supposed to hinge. It's kind of like a knee. It's only supposed to hinge, and there's like a little rotation added to it. But mainly we need to watch out for these bigger muscle groups on the butt, like on the front of our arms and the back of our arms, to be balanced. So what you can do, for example, if you have elbow pain up here, and then first you're gonna have to test it out, like if this is the issue that we're dealing with. So if you lay down your hands flat on the table and resist a little bit with the other hand and start to pick it up and hold that. If that's giving you pain, that means that you might have some inflammation or some kind of acute issue going on with your extensor compartment and the tendon that connects the extensor compartment, the extensor muscles, to your lateral epicondyle of your humerus. So like you're gonna feel the pain around this area. If you can pinpoint it, like it's a sharp pain or something, then we're gonna get on that spot. So just remember that. And that's how I know that it's going to be more in the muscular tendinous junction or in the muscle, like it's going to be muscle and soft tissue related. So that's good. So what you're going to do is we're going to have to release the flexor compartment. So you're going to grab a ball, tennis ball or a roller, whatever you have at home. And then by relaxing your wrists, like you're just going to roll around on that. Try to relax those flexor muscles. You can get in there a little bit. Cover the whole muscle all the way up into your elbow. You don't have to go too close to the wrist because it's mostly the muscle tissues are up here, and then these ones are mostly tendons. And then you can also get into it with your fingers. So you can apply a little pressure and move your wrist around. Apply a little pressure, move your wrist around like so. Or you can just come and then get it, squeeze it a couple of times. See if there's any like tender spots. If any spots needs more attention, then you can stay on it a little bit more and really just kind of like loosen up and warm up that tissue. And then after that, what we can do is that we're gonna get into the extensor compartment. So if there was a spot that was like sharp pain in one spot, then you're gonna get on that spot with like 2 fingers, and we're gonna do this like little cross fiber flexion. You don't need lotion because you want the skin to drag with your fingers. So you want the skin to move because we are trying to shear those layers separately, and we're going to try to introduce some movement. So you're going to go a little bit. You see how like this is moving less in this way than this way. You might feel some crunchy, so in that case you can stay on it a little bit longer. And you're just going to do that for like 30 seconds. Each spots, move around a little bit. Good. And then we need eccentric loading. We need to load this tissue. So the new tissue that they're laying down, that your body's laying down, it's aligned with the load. So we need that to be functional. So what you're gonna do is like, you're gonna pick up your wrist like that, not too much. You don't try to force it too much, especially if it's still painful. You can decrease the range of motion. The other hand, you're gonna resist a little bit. You're gonna let it push down, like so. So with 2 fingers, I'm pushing down my wrist and I'm resisting myself a little bit. So I'm pulling up, like resisting this way, and I'm pushing down with 2 fingers like that. Really good eccentric load. Try to distribute it evenly. If you feel the pain, the sharp pain still, then you can go back and do the cross fiber friction in any direction more a little bit and do it again, or decrease the range of motion a little bit more. You're just trying to load the tissues but not re-injure them again. And after that, you don't have to go too fancy with your strengthening exercises, but we're going to do the concentric part of it. So you need a rubber band, and you're just going to wrap it around your fingers like so, like the old games. And all you're gonna do is like lay flat, your hands lay flat on the table, And this is the extensor compartment. This is what we're trying to strengthen. So I need to extend my wrist and my fingers. I'm gonna slowly come pick it up, lay down, open my fingers, pick it up. Open my fingers, pick it up, open, extend my fingers and my wrist, and just go all the way up. So I'm just going all the way up as much as I can. You can do that at home or in your pocket, even just like in the air, like extensing like that helps a lot. If you have thumb issues, you can just do the thumb, getting this stronger. If you're on your phone all the time and you're pushing down, this might be a good exercise to like get it stronger on the opposite side a little bit. You can do that. Excellent. And then you can still get into the soft tissues of the extensor compartment. You can do like more myofascial release around your wrist. You can work with supination and pronation of the forearm. So that way what you would do is like, this is supination. If I'm trying to stretch the supinators, this is like perfectly good range of motions. You don't necessarily need more than that. But what you would do is like, I'm resisting here, right underneath my thumb, and I'm trying to rotate my hand this way. But I'm gonna resist, not move, not move, not move, push, 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 push. And then inhale, exhale, relax. And then I'm gonna take my hand more into a rotation, even more, like so. Same thing with the pronation. So this is pronation, this is plenty of range of motion, but if you want more, same thing. What I would do is like grab my own hand, I'm trying to come up, I'm trying to do this with my right arm. I'm resisting, 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 push, push, push. And relax, inhale, exhale, and take my hands more into pronation. So try those exercises mainly as the flexor extensor compartment imbalance that can cause that elbow pain. So check that out if that helps. You can also seek out professional help just to make sure that everything is okay. So you want to know, especially if you have like more serious symptoms or any kind of like neurological symptoms, you want to get it checked out. And then make sure that everything structural is okay. But you can start with these exercises and see how that feels. Let me know.